Alrighty, well, we'll go ahead and get started since it's 5 o'clock. Um, just wanted to say hello and welcome to everyone. I am Dr. Amanda Scott. I am the program director for the post-professional doctorate of occupational therapy program at Valparaiso University. I apologize ahead of time if you periodically hear my dog whine. He likes to be center of attention, so and making sure I'm doing my part on social distancing. So I'm coming at you from my living room. So wanted to talk a little bit today about clinical leadership in the midst of COVID. I'm getting a lot of calls from folks where they're really feeling a lot of anxiety and depression and burnout based off of how their leadership is leading in this kind of uncharted territory that we're in right now. So I want to kind of be able to reframe and refocus a few things and explain a little bit about why leadership is doing certain things that they're doing and why they're not doing others. And by no means is it to be taken as, you know, I'm condoning bad behavior or anything like that. But I think sometimes just understanding and getting some insight into the motivations why they're making certain decisions can be really helpful and enlightening in order to help us cope better with what's really going on out there. So first off, we have to have a really good understanding that there is a difference between leadership and management. So management is working with systems, managing outcomes. It's that external skill set where you're really going through and figuring out how to meet certain objectives. Where leadership is more of those internal skills of making people feel safe, making them feel appreciated, motivating and inspiring folks. So that's really the difference. And just because I'm a good manager does not make me a good leader, and vice versa. And one of the things that is a bit of a pet peeve of mine is so much of the time within any corporation or any business entity, people are promoted into management positions not because of good management skills or good leadership skills, but because whatever the task was that they did, you know, for instance, like a frontline clinician, they're getting great patient outcomes, they're getting great, you know, customer satisfaction and productivity and billable units and all of these different metrics that were measured on in healthcare. You know, they're great at performing with those aspects, and then that's why they get promoted, but they don't necessarily have the management or the leadership skills in place. And so folks are being promoted without necessarily being mentored and being taught those really important skills. And anytime we are in an extreme crisis situation, and you know, one like what we're in right now with this pandemic is just absolutely unprecedented. So it's really taking a spotlight and shining it on all of the inadequacies within management. And right now, I would argue that right now the hardest job in healthcare is middle management. So it's taking those corporate directives and trying to translate them into something that's usable, that's feasible, that frontline staff can hear and can be successful at achieving. And so right now, those midline managers are really struggling to maintain that balance. You know, I always say it's the fiscal versus the clinical, right? And it's a balancing act. And so right now you're feeling a lot of frustration from those midline managers, and they weren't given the skill set and the coping skills to be able to handle anything remotely like what we're all going through. And because of that, you're starting to feel some of the frustration and tension from your manager, which then increases your frustration as a frontline clinician. And so now it's creating kind of this downward spiral, so to speak. And so it's how do you break the cycle? And so one of the ways that we can start to work toward breaking that cycle is, for me as a frontline clinician, I need to recognize that number one, my manager is human. That Maybe they weren't given or taught all of the skill sets needed in normal everyday management. So now that we're in this extreme situation, they really don't have the skill set to be able to deal with the situation how I think that they should. So instead of berating my manager, I need to be able to step back and say to my manager, okay, I want to assume more of a leadership role. How can I help? Here's what I'm seeing is the issue, and here's what I think is a possible solution or a possible action step that we can do. Because right now what's happening is, especially midline managers, are getting overwhelmed, right? And so it's such a big problem with how things are going with this pandemic. And, we're short on supplies, we're short on staff, it's so many things all at once that they're having trouble processing and breaking it down. My students will tell you that one of my favorite idioms is, how do you eat an elephant? One bite at a time. And so when we are looking at that large elephant, we're getting that analysis paralysis, especially as managers, especially as underskilled managers. So for you as a frontline clinician to step up and say, you know what, I know this is a big problem. Let's start with, maybe looking at maybe staggering scheduling, for instance, especially in the therapy world. I know this is starting to become a big discussion of, having some folks working Monday through Friday, some working, Tuesday through Saturday, Wednesday through Sunday, in order to try and help with the management of that flow and influx of patients, and trying to make sure that everyone is getting their hours. So trying to think and be more flexible when it comes to that kind of thing can really help take some of that stress off of your manager. And now it's allowing you to step up into more of that leadership role. So much of the time when it comes to leadership compared to management, right, it's where we step up during a crisis situation and we can assist with problem solving. And then once the crisis is over, then we can step back into our previous clinician roles. And so that's the sign of good leadership, is being able to know when to step up and when to step back. And so I think for a lot of folks right now, we're feeling the sense of out of control, and that's increasing our anxiety, it's increasing our depression. And so we need to start to get back a little bit of semblance of control. And there's the old adage that the only thing I can control is how I react to a situation. And so asking yourself, okay, yes, this is a bad situation. Yes, I'm unhappy. Yes, I'm overworked. I'm exhausted. But stepping back and going, okay, what can I do in order to help with this situation? That's really a key. And when your managers start to see you stepping up like that, it takes a lot of burden off of them. It takes a lot of stress and frustration off of them. The other aspect too to remember when it comes to leadership and management is why are you frustrated? What is frustration? Frustration is essentially unmet expectations. And so again, going back to the things that you can control your expectations. So are your expectations too high right now based off of the situation, the extreme stress and kind of chaos that we're currently in? So maybe step back and reevaluate what your expectations are for you and for your manager, and kind of reevaluate that and look at, okay, now maybe I need to lower that, or I need to be more realistic with that expectation, and that will decrease your level of frustration as well. One of the things that one of my students and I actually had a really interesting conversation about was that she was feeling a lot of frustration, feeling overwhelmed, feeling undervalued. And as we were talking, it came to light that she was already feeling that way before the COVID crisis. And so now all of those negative feelings are just amplified because of the situation. And so one of the things I think with managers right now is when they're weaker in their management skills, they didn't make you feel valued and appreciated before, you're going to feel even less valued and less appreciated. and more overworked, and it's going to lead to more burnout. And so right now in this type of a situation, burnout is inevitable. I think we're all starting to feel it. And so, but only you can start to manage and identify some of those different triggers for burnout. So if you're looking for that validation from your manager in order to feel appreciated and valued, and you're just not getting it, maybe you're looking in the wrong spot. So yes, we all like for our managers to recognize what we're doing, why we're doing it, when we're doing a good job. We all like to be validated from that standpoint. But right now, the managers, especially those mid-level managers, are just trying to keep their heads above water. And so trying to be more of a resource between you and your peers for that validation can be really, really helpful in helping with burnout, right? It will strengthen your relationships with your peers. And because at this point, we're all in the trenches together. And so how can we support each other a little bit better and make each other feel a little more appreciated? There's a romantic relationship book called The 5 Love Languages. And I like to take some of those concepts out of that book and apply it into management, right? Because when you feel love, you can kind of equate it to appreciation. And so within that book, those 5 languages of, gifts, words of affirmation, quality time, those types of things, everybody feels appreciation different and wants to be shown appreciation in a different way. And so understanding that about you and your peers and your managers and try to complete that loop of some folks like a lot of pomp and circumstance, right? They like an email to go out to everybody saying, Sally, did such a great job with this patient. We had this great patient outcome, hooray, Sally. And there's others that are, just a simple thank you is plenty. And yet then you have someone else who, hey, cake in the break room saying, great job. That's what I like, in order to feel appreciated and valued and recognized. And so we need to do a better job as managers of validating folks in the way that they can be receptive to it in order to feel appreciated. And that way, when things like a major pandemic hit, you've got a little bit more latitude as a manager with your staff, that when things start to go haywire, okay, yeah, I can't dedicate as much time to making sure that you feel validated and appreciated, but they will have already felt validated and appreciated before that. So it's less work during that crisis. One of the other key concepts with leadership, and along with that whole feeling appreciated, it depends on what that leadership style is and that management style in particular. So with the management styles, we have a lot of folks that try to be more autocratic or democratic in their approach. And those are folks that are going to be taking in your feedback and having more input from their staff in making those decisions, getting staff buy-in. And Simon Sinek is a leadership expert who likes to talk about explaining the why and making sure folks understand the why behind it. And yes, in a normal situation, that is absolutely appropriate. And one of the things I think that's leading to some frustration with frontline clinicians is it's becoming more of like that dictatorship style management that's going on right now, where maybe it felt a little more autocratic versus authoritative. And now it's more of that authoritative approach, and folks are feeling stressed out from it because it's a management style that they're not used to. And the reason why a lot of managers are defaulting to more of that authoritarian type of management style is because everything with our healthcare landscape is changing so rapidly that we actually have to step back and go, okay, I don't have time to get everybody's exact input. I don't have time to make it more democratic and have everybody vote on what we do next, because decisions need to be made, actions need to get into place a lot faster than than in a normal situation. And so I think that's another source of frustration for the frontline clinicians, is just seeing that different style of management compared to what they're used to. And, you know, to keep in mind as a frontline clinician that this is temporary, right? There will be an end in sight. We will have life post-pandemic. We just don't know what that looks like yet. We don't know time frame yet. You know, there's a lot of speculation. You know, is it going to be a month? Is it going to be, 6 months? Is it going to be a year? You know, who knows? But in the meantime, try to think forward to the future. As that frontline clinician that's getting burnout and feeling frustrated, what do you want your ideal post-pandemic world to look like? What do you want that relationship with your manager to look like? What do you want that relationship between management and staff in your job, in your organization to look like? And so you can start to take some steps on how to really enact that vision now. And what that does is it also gives you that sense of control again. And it gives you that sense of hope that, yes, there is life after this. And so it gives you something to look forward to as well. And also helps start to lay a foundation for what that post-pandemic world can really be. So right now we are living in a time of extreme change. And with the rapid change, we need to start to scale down the change a little bit. So, and what I mean by that is, again, going back to that old idiom of how do you eat an elephant? One bite at a time. And so because everything's changing so rapidly and it feels so chaotic and inconsistent, me as the manager, I need to start to step back and look at, okay, what changes are absolutely necessary? What can I keep the same? Right? What can I keep that's comforting and that's consistent and that has worked in the past? Because when I can keep some continuity, it makes those things that are changing a lot easier for folks on the frontline staff side of it. So that way they don't feel like they're having to completely change everything and throw the baby out with the bathwater, so to speak, and how to redo everything that they've learned on how to do their jobs. So keeping certain things consistent and then pointing that out, here's certain things that haven't changed, whether it's pre-pandemic, during pandemic, or post-pandemic. So, one of the things that is not changing, obviously, is the dedication of those of us on the front lines as healthcare providers. And so our dedication, our passion for our professions, whether it's nursing, physicians, therapists, everybody in between, housekeeping, you name it, everybody is going through this. And so you're passionate about what you do and why you do it, and that's something that's not changing. And so make sure you're going back to that and remembering and even journaling. This is why I came into the profession, right? This is why I normally enjoy my job, right? Because not many people can really say right now that they're actually enjoying their job just because of the extreme stress and extreme change that we're all going through. We just feel like we can't get our feet under ourselves. So journaling about that, and then looking for those different elements. Again, what has stayed the same? What are some of those constants? And then taking solace in some of those constants. When we're looking at managing in this type of a crisis, managers should be going back to the management process of the 4 steps, which are planning, organizing, motivating, and controlling. And so whether you're talking a bigger, large scale project or a smaller scale project, anything in between, doing that process gives you a more systematic approach to the situation. So that way you can really start to dive into what needs to change, what needs to be those action steps, and then how do I get folks on board with it? So with the planning phase, that's identifying the need, right? And starting to set up your objectives. The organizing is looking at what are my resources and then how can I coordinate those? So resources can be people, time, funding, equipment. Looking at, okay, what are those resources? What are those who are those stakeholders that are feeding into those objectives? And what all do I need to have in order to be able to meet those objectives? Then that moves me into the motivating phase of, okay, so I've got my objectives, I've got my action steps, I know what my resources are. Now I need to get my folks on board. So I need to sell the idea to them, right? They need to feel invested and they need to feel like that the process is actually feasible, that they can actually accomplish those action steps. And then the final phase is controlling. So that controlling phase means monitoring your outcomes, what's working, what's not, what objectives need to be altered, what action steps need to be altered in order to overall meet that goal. Now, as therapists, you might be saying, well, that sounds kind of like our basic clinical reasoning process. And that's because that's what it is, right? So much of what we do as therapists, you know, when we're doing that initial evaluation, right? We're taking in that assessment. We're looking at what are those underlying impairments, those functional deficits, you know, where are that low-hanging fruit, so to speak, on what do I need to fix first? What'll give me the best impact? How do I set those goals, right? That's that organizing of looking at, okay, what resources does this patient have? You know, do they have at home, you know, set up with equipment or caregivers or, you know, financial resources, you know, whatever it is, right? We're always looking at that stuff in order to see how we can develop that plan of care, right? And then as we're going through and developing those short-term and long-term goals, we're figuring out, okay, what treatment interventions do I need to do based on all of that? And then going back and doing that check-in point of, did they accomplish their goals? Which ones did they accomplish? Did it improve their function overall? So very similar to, so our clinical reasoning process as clinicians is very similar to that of what the management process is. So kind of almost look at your managers, look at the situation as if it were one of your patients. And how would you start to tease out what needs fixed, what doesn't, what needs fixed right now, and what can get fixed later? And then creating those objectives and figuring out what are my action steps that I need to take next. As we're going through this process and we're starting to feel the burnout, we need to take a step back and make sure that we are doing a little bit for ourselves. So whatever it is that refuels your energy, refills your cup, do it. Even if it's just taking 5 or 10 minutes of a break and just sitting quietly to meditate, be mindful, exercise, something, whatever starts to help you manage some of that anxiety and those feelings from burnout. Because remember, burnout it's not just that mental aspect, but can also manifest with physical things like headache, nausea, vomiting, those types of things. So make sure that you're taking some of that time in order to recenter yourself. And it is okay. Give yourself permission for that. A lot of times we as healthcare providers are harder on ourselves than anyone else. And so if you're giving that patient, you know, advice on how to balance the mental health with the physical well-being, are you taking your own advice? Be kind to yourself. Give yourself permission to take that step back and go, you know what? I just need to walk away for 5 minutes. I need to go out and get a breath of fresh air, a chance to collect myself and recenter, and then go back in. Make sure you're giving yourself that outlet. Because when you're running yourself down to empty, then that's when your coping strategies are going to start to fail, and you're going to feel more burnout. You're going to lash out, and now your managers are going to lash back, and it just creates a very negative situation. Another way of helping to cope with some of the burnout with management is stepping back and looking for one positive. Right now we're so bombarded with the negative, that find one positive within, whether it's how your manager is managing, or within your organization, or how you and your peers are coming together and really supporting each other as a team. There's got to be something that's a positive. And so make sure that you're pointing that out, because that will help break some of that negative loop that you're starting to feel. Because if you're getting into that negative loop, then that's going to really feed on that burnout and that level of frustration and anxiety and depression. And as you, as the frontline clinician, as that increases, it's going to filter up to your manager, right? And then they're going to start to feel that if they're not already. And then that's going to spread. So try to find that positive as well, and make sure that you're talking with your peers about it, and making sure that you take that time to step back and say thank you. When it comes to leadership, especially in these times, make sure you are taking on more of that servant leadership style. So there's 6 main qualities that are found in kind managers that are good leaders. The first one is integrity. So in a nutshell, mean what you say what you mean. Be consistent. The second is humility. Third, compassion. Fourth, humor. It's okay to come up with like a bad dad joke, for instance, and in order to help break some of the tension. We have to find the bright spots. There's always going to be some type of a bright spot in the midst of all of this. And if your manager is not able to demonstrate some of these different qualities, then it's up to you to do it and take on that aspect of leadership. Gratitude. Saying thank you. Doing something nice for someone, even if it's small, can be very, very helpful, especially in these times of high stress. And again, it doesn't have to be a manager that's doing this. This can be you as a leader. And then, of course, the final quality is authenticity. Being sincere. Don't overpromise and underdeliver. And as you're going through and you're stepping into some of these more leadership type qualities, remember that leadership does not have to be this big thing that I have a title and that, you know, everybody looks up to me. Leadership is stepping up and helping out. And anyone can be a leader. And making your manager trust that you can step up and help lead can really, really be beneficial, both for you and for your manager. It's also going to be better for the patients as well. So, any questions? I'm going to unmute everybody here and see if anybody has any questions. Okay, I think I got everybody unmuted. Any questions or comments?
You know, Amanda, I might just have one question here.
Sure.
You know, I like the qualities of leadership that you mentioned, and that included authenticity. When it comes to leaders who might be experiencing a lot of stress and fear themselves, how do they manage that balance of being authentic without letting on perhaps, some of those other concerns that they have, or should they let those other concerns on to people? How do you manage that, do you think?
Great question. I think you maintain the authenticity by being truthful. Now, by being truthful, for me as a manager, I'm not going to be telling everybody everything, right? But I am going to be truthful with the items that I am sharing, right? Because for me as a good manager, I should not be allowing my level of frustration, with upper management, for instance, to trickle down into the folks that I manage. So being truthful and authentic means being consistent with the message and believing in the messaging. Any other questions?
I was just going to say thank you, Amanda, Dr. Scott, because it's just good to hear that. You can get a lot of takeaways from that, and especially, talking about your own anxiety and your own burnout and, how you have to cope with that before you can, be the person that's the leader to others. And it's so important to take that time. Mm-hmm. So that's always a good message to hear.
Yeah. And I think a lot of folks kind of assume that you've got to be practically like a superhero to be a leader, and you don't, right? We're all in this together. We're all feeling burnout, and yeah, we just kind of need to take that step back and say, okay, what portion can I do, right, to help? And again, we know our peers, right? We know how folks like to be shown appreciation, whether it's bringing in donuts or saying thank you, or, posting a sign, of something great that, that your coworker did. Everybody likes to have that recognition in a different way. And so I think it's really important that, we're recognizing each other, especially when management isn't or can't or won't for some reason or another. We've got to give each other that level of support. And that's where stepping up as a leader can be just as simple as that. Any other questions? I think the last takeaway is, just make sure that you're being kind to yourself, being kind to your managers, because again, this is just such uncharted territory that most folks don't have the knowledge base and the coping skills, to be able to sail through this. And so folks are having to kind of learn by, trial by fire, so to speak. So making sure that you're giving folks that latitude, I think is very important during these times. Any other additional comments or questions? So I'll just end on, for folks that might be interested or thinking about pursuing their post-professional doctorate in OT. I cover in a lot more depth the different management and leadership styles and fundamentals of what makes a great manager and a great leader in our coursework as part of that particular program. And so if anyone is interested in pursuing the post-professional DROT at Valparaiso University, you can certainly reach out to me. My email is amanda.scott@valpo.edu. You can also get more information on our website at valpo.edu/occupational therapy.